Great, thank you. Okay, good morning, everybody. Welcome to the Spotlight series for patient-reported measures. Thank you for joining us. And my name is Kim Morey, and I'm the co-theme leader of the Wardliparringa Aboriginal Health Equity theme here in SAHMRI, and I'm chairing as a guest chair today for today's session. So we would like to follow appropriate protocol to start the webinar, and that is that I'd like to acknowledge the Kaurna people as the traditional custodians of the Adelaide region, where we have the honour of meeting today, most of us hopefully, but I also want to acknowledge that Kimberly and Mel are coming in, I think, from New South Wales, and so we'd like to acknowledge the traditional owners of the country that you're on there in New South Wales. We recognise the Kaurna people here in Adelaide, their ongoing spiritual connection to the Adelaide and Adelaide Plains region. I'd like to pay my respects to their ancestors and to the elders, and acknowledge the next generation of the Kaurna people, and obviously the traditional owners across South Australia where SAHMRI conducts our research, and obviously the traditional owners across the country. So thank you very much. So this Spotlight series is an initiative that's been launched by Health Translation South Australia in November 2021. And it's really a way to build knowledge and capacity in a range of essential research translation skills and topics that may not be well understood. And so Health Translation SA do this through month-long focus education initiatives with 4 online webinars. And for the current series is on patient-reported experience measures. And so Health Translation South Australia are co-hosting this today with the Commission on Excellence and Innovation in Health in South Australia. Just to give you a little bit of background information about who Health Translation SA are. So briefly, Health Translation SA is a NH and MRC accredited research translation centre, which really focuses on connecting health researchers and health services with the right stakeholders and partners to really accelerate the implementation of research discoveries across the healthcare system. And you can see all of the partner organisations that are a part of Health Translation SA. As I mentioned, I'm from the Wardliparringa Aboriginal Health Equity theme, which is one of 4 themes within SAHMRI. I just want to acknowledge that Wardliparringa is a name that's been gifted to us by the Kaurna people, which Wadli literally reflects or means house, hut or shelter, and Parringa references the river system in which SAHMRI is located. So Wardliparringa refers to house or place by the river. But it also has a reference to a dreaming story of reflecting the Milky Way, reflection of the river system in the Milky Way, and is a dreaming story. And so the name has been gifted to us by the Kaurna people, and so we're very privileged to have that name. And our theme really is focused on reducing disparities experienced in health and wellbeing by our people, and really supporting and developing and strengthening the next generation of Aboriginal and Torres Strait Islander researchers to improve health outcomes for our people. All of our work is underpinned by the South Australian Aboriginal Health Research Accord. So our program of work has been determined by priorities from our community, and all of these other principles are how we operate. This was a foundational piece of work that we undertook when we first began in SAHMRI, and we have all of the 3 South Australian major universities are signatories to this accord, as well as SAHMRI, the Aboriginal Health Council being our peak body, and the Council of Elders kind of gave the endorsement for the accord. And this is really what informs the way that we operate our research in South Australia. So really excited today to be hearing from 2 speakers that are working in the patient-reported experience measure area. So developing culturally appropriate PRMs for Aboriginal and Torres Strait Islander community, and privileging the voices of Aboriginal and Torres Strait Islander people through this work. So we have Mel Tinsley from the Agency for Clinical Innovation, and Kimberly Williamson from the Cancer Institute of New South Wales. And Mel and Kimberly will both present for us for around 20 minutes, and then we'll allow some time for a Q&A at the end of the session. So we're very excited to be hearing from both Mel and Kimberly today. So just to introduce Mel, Mel is the Associate Director of Integrated Digital Enablement Accelerator at the Agency for Clinical Innovation, and Mel leads a diverse and dynamic team focusing on driving systems transformation by bringing people, processes and technology together to improve the outcomes and experience for people accessing and receiving care. And one of her program areas is privileging the voices of Aboriginal and Torres Strait Islander people within patient-reported measures and programs. So I'll stop sharing now, and Mel, if you wouldn't mind, we'll get you to take over, and we're really looking forward to hearing from you.
Yeah, thanks very much, Kim. And I am going to transition from my phone to my laptop, so there will be a slight delay. I'm going to turn my camera off on my phone and I'll share my screen on my laptop, but I won't be very long. Can I just confirm, Kim, that you can see that?
I can see that, but you just need to hit your slide into presentation mode, but yes, it's up on the screen. Great, Mel. Yep.
All right. I just need to turn my phone off. Sorry, give me 2 seconds. All right. I think my audio is sorted. I apologize for that. And thank you again, Kim.
Yeah, Mel, we're just getting a bit of echoing there. We can see your screen, but your volume is just a bit of echoing there through the volume. Do you want to try that again?
Such a lovely welcome.
Yeah, that's
I do also want to acknowledge the traditional owners of the land as well, that we are. Sorry, Kim, I think you're saying you can't hear me.
We can now. You're okay now. It seems to have come good. So thank you. We have lost your slides though, Mel.
Yep, I was just about to say that. Why don't I share the slides on behalf of Mel, and then hopefully she can just get back on her phone.
Yeah, that'd be great. Have you got them there?
I've got the PDF, but let me just double check that.
They
That's
did
okay.
work.
Let's run with
practicing.
Yes, of course. It's always the way, isn't it? That's okay. Let me quickly just share my screen. It is the PDF, so please let me know if this isn't working. Oh, wrong one.
Yep. Yep, we can see that.
Yep, you can see that. Yep.
If you just make your screen a bit bigger.
How do I do that on a PDF?
Can you zoom in?
I can. The only issue is then.
No, that's not going to work, is it?
No, it's not. Let me just. We might be okay. I'm just going to have to scroll. That's all, if people don't mind that.
Can everybody see that okay?
Yes, I can see that.
Okay, well, let's go with that. Thank you, Kimberly.
No problem.
Okay now, Mel?
Maybe we've lost her altogether.
So Mel was traveling. She's in the outback, and she was concerned that she may drop out. So,
well, what if we, Kimberly?
Do you want me to go first? Yeah, Mel's probably. Yeah.
Yeah, let's get you to go first, Kimberly. And if Mel comes back on,
yep,
we'll get her on, and if not, we'll go with a plan B.
Yep, absolutely, no problems.
Thank
knowing
you so
Mel,
much, Kimberly.
no, no problems.
Can I just quickly introduce you then? Would that be all right?
Sure. Yes, of course.
Yeah.
Yes.
Okay. So, shifting to Plan B, I'd like to introduce Kimberly Williamson. So, Kimberly's worked at the Cancer Institute for 10 years in her role of Program Lead Patient Experience. She oversees the development, implementation and embedding of the Institute's patient-reported measures systems in New South Wales Public Cancer Services, which also includes the Institute's culturally and linguistically diverse communities and also Aboriginal patient-reported measures programs. And additionally, Kimberly also oversees the Institute's patient information portal and cancer website. So that'd be great if we can get you to present for us this morning, Kimberly. So thank you.
No problems. Thank you, Kim. Quickly just share my screen. I will just need to jump it onto presenter mode. So just give me a moment. Alrighty, let's get started. Before I begin, I too would like to acknowledge the traditional custodians of the lands on which we work and live and recognise their continuing connection to land, water and community. And I'd like to also pay my respects to elders past and present and any Aboriginal people we have joining us on the call today. I'd also like to acknowledge this beautiful artwork that was designed for the Cancer Institute by Dennis Golding in 2016. Dennis is a Kamilaroi man and is currently Sydney based. And this artwork illustrates and reflects the Cancer Institute New South Wales, which is how it collaborates and shares values with other networks to foster greater knowledge, awareness and success of health services for Australian Indigenous communities. Alrighty, so just a bit of context for those that may not know the Cancer Institute. So we are a pillar organisation of New South Wales Health, and we provide the strategic direction for cancer control in New South Wales. We are the only state in Australia to have a cancer control agency, and we work across the healthcare system to promote better cancer prevention, early detection, diagnosis and treatment and care. And behind everything we do, we collect and use the latest cancer data, information and evidence to drive improvements in cancer outcomes across our cancer services. We also have a statewide cancer plan called the New South Wales Cancer Plan, and that has a guiding principle of being patient-centred care with a core goal of enhancing the quality of life and experience for people at risk of and affected by cancer. And the My Patient Reported Measures programs falls within that strategic goal. Central to the New South Wales Cancer Plan is also driving equity across equity of access and outcomes. And we do have defined focused populations that you can see on the screen there. From a patient reported measures program point of view, we have focused on 3 as an initial starting point. And those are rural, regional and remote communities, multicultural communities, and of course, Aboriginal communities, which I'll be talking about the work we're doing in that space today. Important to note is also that the Cancer Institute will also be developing an Aboriginal cancer plan and will be engaging an Aboriginal organisation to develop this in partnership with us. And this work is commencing soon. Okay. In terms of the work we're doing to support Aboriginal communities, what the evidence tells us is that Aboriginal people are more likely to be diagnosed with cancer, they're more likely to be younger when diagnosed, and they're more likely to die of cancer than non-Aboriginal people. There is a New South Wales Aboriginal Health Plan, and that goal focuses on partnership and partnering with Aboriginal people to achieve the highest level of health possible for individuals, families and communities. And the national and the definition of Aboriginal health within this health plan is from the National Aboriginal and Islander Health Organisation. And it's Aboriginal health means not just the physical well-being of an individual, but refers to the social, emotional and cultural well-being of the whole community in which each individual is able to achieve their full potential as a human being, thereby bringing about the total well-being of their community. In relation to the work that the Cancer Institute are doing, and particularly the patient reported measures programs, we're supporting and partnering on 2 projects. The first one is the What Matters to Adults research projects. And for those of you that have the privilege of knowing Professor Gail Garvey, we have partnered with her and also Professor Kirsten Howard, so from the University of Sydney and the University of Queensland, on a medical research future fund. And this grant is about investigating the well-being of Aboriginal and Torres Strait Islander cancer patients and exploring the system barriers and enablers of using an Aboriginal specific PRMs patients in cancer services. So we're testing the implementation of the What Matters to Adults measure. And this is a holistic wellbeing measure developed by Professor Gail Garvey. And this was developed via an Australian National Health and Medical Research Council project grant. And it was in partnership with and underpinned by the values and preferences of Aboriginal and Torres Strait Islander people across Australia. The learnings from this research project will inform the best way of using the What Matters to Adults in clinical care to measure and address patients' wellbeing needs. And it will guide broad evidence-based implementation of What Matters to Adults and improve and how to use this to understand the contribution of culture and health to their wellbeing. And it will also inform the wider implementation of the What Matters to Adults patients services and settings. This is just to give you a bit of a snapshot of what the What Matters to Adults tool looks like. So it has 10 dimensions. And it's measuring components of wellbeing and culture that matter to Aboriginal people, like I mentioned. So those some of those dimensions are belonging and connection, holistic health, purpose and control, dignity and respect, basic needs of self, family and community. So within each of these domains, there's specific questions to help unpack where there may be some needs or support for our Aboriginal patients. This is the first developed electronic version of the tool. And from a Cancer Institute New South Wales perspective, we're providing the technical capability through our statewide patient-reported measures system and supporting the enablement of the work of 4 pilot local health districts or cancer services and the research team in using our system to facilitate the completion of these surveys. We'll also be hosting and making available the data to the research team and the cancer services when it comes to reviewing the data on completion of the data collection phase of the research project. The second project is the Coordination of Care project, and this project really is all about it's about localising the implementation of the optimal care pathway for Aboriginal and Torres Strait Islander people with cancer. And the OCP, it covers the stages of the OCP from diagnosis to discharge and how to improve the cultural safety and treatment outcomes of our Aboriginal patients. So we're providing the funding to cancer services to establish an identified role to help support Aboriginal people with cancer navigate through the complex health system, feeling culturally supported and safe. And through this, they'll be utilising the What Matters to Adults measure and also the Supportive Care Needs Assessment tool for Indigenous people, also known as SCNAT IP, to help track and measure how patients are feeling and tracking longitudinally if things are getting better for those patients. And this is just to show you what the SCNAT IP tool is about. So and I guess and also the support that the Institute will be providing. So again, it's being piloted in 4 local health districts. And the SCNAT IP tool itself was designed and developed for Aboriginal people with cancer, and it covers 27 items across 4 domains. So we have the physical and psychological, hospital care, information and communication, and practical and cultural. And again, this the Institute has PRM system is the first to roll this tool out in an electronic version. And again, we'll be hosting and making available the data to those services so that they can obviously you look at that data to determine where there's gaps in services and care being provided to our Aboriginal patients. What we will then also be doing is, as we're further along in the pilot, what's important for us is getting the data into the hands that can change the way that care is delivered. So for us, it's our clinicians and our cancer services management. So we will be within the oncology information systems used within the local services of which our PRM system is implemented in. We will be providing them with dashboards that they can look at within their oncology information system system. So just like they're looking at their clinical data, they'll also have dashboards that links in their patient reported measures survey results. So they'll be able to link the clinical data with the patient reported measures results to get a holistic view of how the patient's feeling, where there's unmet needs, and where additional support is required for those individual patients, but then also be able to look at that, slice and dice the data in many different ways in order to be able to see where there's opportunity at a service level for improvement as well. If anyone has any questions, there's our contact details there. Thank you.
Thank you, Kimberly. That was really interesting. So I might open up for a couple of questions, and then we'll move on to Mel, because I see Mel's back online. So is there any questions for, would you prefer Kim or Kimberly?
Kim's fine, Kim.
Kim, great. Kim times two. Is there any questions for Kim at all? Don't look like we've got any questions just at the moment, so we might move on to Mel, Kim.
Sorry,
and then
Kim,
we'll come back.
sorry, Kim, to interrupt. I just noticed Loretta had raised her hand, so I've allowed her to talk now.
Okay, thank you. So Loretta, if you've got a question.
I do have a question. Sorry, it is actually Neil. So we're just using my laptop today, and Neil is coming from Port Lincoln Aboriginal Health Service and is sitting with us today. So I think he's ready to go.
Hi,
Great, thank you. Hi, Neil.
I know you mentioned a lot of research, and I did understand that you showed the health and wellbeing, the paperwork for it. How also, though, practically do you see it within maybe an Aboriginal health organisation sort of community, though? Have you sort of gone, how remote have you gone in the 4 areas?
Sure, good question, Neil. So at the moment, our intention is to pilot it as part of the research project. Our intention is then to offer this survey statewide through all of the cancer services that utilise our system, of which we'll pretty much have statewide coverage over the next 12 months. We're still implementing. In terms of the pilot sites, I don't know how well you know the geography of New South Wales, but our sites are mid-north coast, southern New South Wales, southwestern Sydney, and Western New South Wales. So from an Aboriginal patient perspective, we've covered city as well as regional and remote to really get a good, I guess, dissection of different patients, patient demographics and patient needs across New South Wales.
Thank you, Kim. Does that answer your question, Neil? I think we'll move on. Oh, hang on, Loretta. Yep.
Yeah, I just wanted to say that, yeah, I understand, because as an RN, I've worked in remote areas before, and we're currently in South Australia, obviously, so it'll be interesting to see your results, especially from the western parts of New South Wales, Broken Hill, etc.
Absolutely. We are also conscious that sometimes regional or remote also means lack of technical access due to internet and those kinds of things. So there are different ways in which patients can complete those measures to try and remove the barrier of location being a reason as to why we're not able to capture patient feedback just because they don't have access to the internet or technology restrictions.
Great, thanks, Kim. Just one more question and then we'll move on to Mel. So great presentation. How are the clinical services operationalising the dashboards, and are there KPIs related to the PRMs?
Good question. At the moment, we haven't set any KPIs. This really is a first for us. So what we're wanting to really focus on is really how is it being implemented? What are the barriers that are coming up? What we're finding is everyone is very engaged and very motivated to make it work, but just the day-to-day barriers within clinical workflows, clinical resourcing, connection with community organisations in order to provide that holistic care to patients are where the challenges are. So what we're really focusing on as part of the pilot is really, what are we learning from this? How is the tool being utilised? By implementing a tool, are we creating additional barriers that we hadn't thought of? But also, is it helping patients and also helping clinicians in order to better support their patients as well? So we are very much in the early stages of this, and we're very aware that we have a lot to learn in this space, as do the cancer services. Hence why we had many LHDs very keen to take part in this. In relation to the dashboards are also quite new. So the way our system works is we automatically give the results from the patient surveys directly into the oncology information system as soon as a patient hits submit. So when a patient is actually, when a clinician is going through the results with the patient, they can also have a clinical conversation with that conversation if need be. So that was the beauty of putting it back into the oncology system, is giving them all the data that they need to be able to make an informed care plan or have an informed discussion with their patients around how clinically are you feeling, but also what are the other cultural considerations around how you're feeling as well, because they are just as important as the clinical. So in terms of the dashboarding, it's very early days. What we've come up with is the slicing and dicing of the things that we think will add value and where conversations might be able to head. But again, through this implementation pilot, that's where we'll really unpack what kind of conversations are you having, what information have you got missing that's already in the system that we can actually automate and bring to the surface for you. So you're not sitting there spending time navigating around a system. We can actually surface all of that for you, so you've got more time with the patient and less time navigating the system.
Great, excellent. So how do we keep informed of the work, seeing that it's in the early stages? Because I'm very interested from a South Australian Aboriginal health perspective, and cancer is one of our priorities in our area. And there's, we've talked a lot about, this kind of, patient experiences. So how will we kind of be able to keep track of how you're going and keep up to date?
Yeah, so for the What Matters to Adults research project in particular, so that is being headed up by University of Sydney and University of Queensland. So Professor Kirsten Howard and Professor Gail Garvey. So if you know those,
yes,
either of those
Gail.
people,
Yep.
I'm sure she'd be very happy to keep you updated. From a Cancer Institute perspective, I'm more than happy for anyone to have my details and reach out at any point. We are more than happy to share our lessons learned as we go along as well from a cancer services point of view. So in terms of the formal communication, that will be coming from Gail and her team and Kirsten and her team. But for those ad hoc just updates, more than happy for people to reach out to me.
Great. Thank you so much, Kim.
Thank
All
you.
right. So we might move on to Mel. So I did previously introduce Mel, but I'll just quickly, I'm not sure if we've got new people on, but just to say that Mel is from the Agency for Clinical Innovation and is the Associate Director looking after Integrated Digital Enablement Accelerator. So she's got responsibility for driving system transformation, and one of her key programs is privileging the voices of Aboriginal and Torres Strait Islander people within patient-reported measure programs. So welcome back, Mel, and I think Kim's going to share your slides for you. So if you're ready, we'll hand over to you for your presentation.
Wonderful, thank you, Kim. Is my audio coming through okay now?
Yes, much better, thank you.
Excellent. I apologise for the audio connection issues earlier. And thank you, Kim W, for sharing the screens as well. Before I do give you an overview of our program, and thank you, Kim, for being so dynamic and jumping in as well, I would like to pay my respects, and I'd like to recognise Aboriginal people as the First Nations people of Australia and the traditional owners and custodians of the lands on which we're all meeting on today. Aboriginal people have lived here for over 60,000 years and are recognised as being the oldest living continuous culture of the world, with unique languages and spiritual relationships to the land and seas. We are strongly committed across the Agency for Clinical Innovation, Cancer Institute and New South Wales Health overall to improving the physical, cultural, spiritual and family wellbeing of Aboriginal people in this state. I'm coming to you this afternoon from the lands of the Wiradjuri people. I am fortunate to be travelling throughout rural Western New South Wales. So again, I apologise for my connectivity issues. Thanks, Kim. I'll move to the next slide. And in the spirit of patient-reported measures and measuring what matters to our people and with our people, I'd also like to recognise, appreciate and acknowledge people with a lived experience who are our consumers, carers and loved ones whose voices are really powerful in all that we do across New South Wales Health, and in particular in co-designing our patient-reported measures programs with us as well. So I'll just give you a little bit of background about the New South Wales Health Agency for Clinical Innovation Patient-Reported Measures program. Formally, across New South Wales Health for ACI, our Patient Reported Measures program has been going since 2014, and we have sought to co-design all aspects of patient reported measures with Aboriginal Torres Strait Islander people, our culturally and linguistically diverse people, and people from all backgrounds as well. So we can make sure that as much as possible, it is an inclusive program. We formally started and thankfully recognised the need to formalise an Aboriginal health working group to govern and oversee the specific elements of privileging the voices of Aboriginal and Torres Strait Islander people back in 2018. That's when we had our original teleconferences with the Menzies Institute, and Kimberly's given a little bit of an overview about the What Matters to Adults Wellbeing tool, and also our local health district and specialty health networks across New South Wales Health. A key part of the work that we did back in 2018, noting that we had already established a patient-reported measures program and we were trying to make Aboriginal health everyone's business, was to really look at our existing tools that we use in our technology platform to identify what the gaps were. Were they culturally appropriate? Were they culturally safe? Could they be used in yarning, as an example? And if there were gaps, and we acknowledge that there are, what are those gaps and how do we identify culturally appropriate tools, as well as identifying and promoting culturally safe practices of implementation as well. So we developed a range of community of interest, community of practice. We have expressions of interest, and we run our patient reported measures program proof of concept with Aboriginal and Torres Strait Islander peoples across 3 local health districts in New South Wales, and I'll give you a bit of an overview of those very shortly. We also rapidly progressed into co-designing and developing our implementation approaches, as well as our evaluation approach as well. And that is all governed, as I mentioned, through the Aboriginal Health Working Group, which is co-chaired by 2 Indigenous people working across New South Wales and Queensland as well. We also recognise, acknowledge and appreciate the value of having data sovereignty and a formalised data sovereignty framework in New South Wales for the purposes of appropriately governing data captured for and with our Aboriginal communities as well. So it will be the first time in New South Wales, hopefully, that we develop and implement that as well. Thanks, Kimberly. I'll jump on to the next slide. And I know the Cancer Institute also has beautiful artwork by Dennis Golding as well. It's really important for us in our Aboriginal Health program to have our artwork displayed and associated within the programs where we are capturing information about things that matter to our communities, because it is a representation that our programs are culturally safe, that our healthcare workers are culturally safe as well. And when we co-designed this with Dennis and our communities, we really wanted to reference and tell the story about patient-reported measures and what that yarning is for, and again, with our people. So we have the circular objects that reference our campgrounds and meeting places and sites, which are connected through the lined patterns that you see there on the screen as well. And again, they represent the river systems across New South Wales Health and the different lands on which we all come together from as well. But also included within the artwork that Dennis did with us are images of boomerangs as well, which is a strong representation of cultural practice and technologies of weapons for hunting and throwing. So we recognise, and what we really want to showcase is the innovative practices which continue to share knowledge, skills and experiences which echo the same practices of which we are seeking to do across our patient-reported measures program as well. On the next slide, Kim. So in terms of our program, and I think it's a really nice complementary overview between the Cancer Institute program and the broader work that the Agency for Clinical Innovation is doing as well. is to really highlight those areas on the screen there. As I said, the Aboriginal Health Working Group governs the co-design, the implementation, the culturally safe practices, and provides recommendations as well in terms of the information that we are getting back from our Aboriginal health workers, as well as the participants who are capturing what matters to them back as well. So it is around assessing cultural validity of our current patient-reported measures, providing those recommendations and advice. So what is culturally safe practice, and making sure that we create safe spaces for that for our staff as well. The governing of implementation, which I'll go into shortly as well. And really importantly for us, making sure that we co-design everything and anything for and with our program as well. I might move on to the next slides in the interest of time, Kim, because I'll unpack those as well. So the Auntie Jean's program is the Aboriginal health program in which we are currently implementing patient-reported measures as part of our proof of concept program within New South Wales, formally acknowledging and noting that people will access usual healthcare and usual services, and they may identify as Aboriginal or Torres Strait Islander in our usual services, but we are really focusing on our Auntie Jean's programs as our proof of concepts. So within the Auntie Jean's programs, there are 3 areas, as I mentioned: Illawarra, Shoalhaven, Southern New South Wales, and Murrumbidgee. The Auntie Jean's program is really built around the idea that better results would or should be seen if the community works together for better health outcomes. So it really is about empowering our elders and for the elders to lead the way as well. It was initially piloted in Tharawal lands, and due to the success of Auntie Jean's, it has now gone across our other sites in New South Wales as well. Really importantly, it does have people attending Auntie Jean's programs with chronic and complex conditions. So within the Auntie Jean's program, the way in which the community capture and use the outcome measures is through a technology platform called HOPE, or Health Outcomes and Patient Experience. Through the Auntie Jean's programs, the way in which the community come together and they self-report on outcomes and or experiences that matter to them is typically through a tablet device, and they do it through their yarning circle. So they come together, and it is a community-led group. When our clinicians are capturing the outcomes that are self-reported by the community groups, that information is available, in real time for our Auntie Jean's program participants to view and see as well. We have developed a whole range of resources for our Auntie Jean's healthcare workers, but also the community members. So again, creating that cultural safety in the absence of having currently for our program a culturally safe tool such as the What Matters to Adults Wellbeing tool, but that is the purpose of doing our evaluation of current tools as well. So on the next slide, Kim, what our clinicians can see and what they do talk about with the participants of the Auntie Jean's program is over time, and it is typically 3 to 6 months in between the PRMs that are done with the program participants and the community members. They talk about their physical health, their mobility, their social roles and functions within community, but also within themselves as well. And then they use the information and the data to then tailor the Auntie Jean's program specific to the participants that are coming to the program. So for instance, one of our Auntie Jean's programs down on Tharawal lands, what they have done as a result of capturing the outcome measures, they identified that physical function and mobility was a really big concern for a lot of our participants. So what they did do was to bring in then physiotherapists and do that in a culturally safe way to maintain that mobility and exercise functionality as well. On the next slide, Kim, is just an example again of what the clinicians see. The community members also see this data in real time as well. So they own the data, they see the data, they control the data, so they can also take this to any healthcare practitioner, but they also use it to see over time as well. They do like yarning about the data and the collective data in their circles through the Auntie Jean's programs and sharing their experiences as well. So on the next slide, Kim, about the implementation and considerations and what we have done, I suppose from a central agency perspective, is we've really empowered the Gene staff to lead the implementation. So we provide them with the talking posters, as you can see, one of our Aboriginal healthcare workers holding there. And what we have done is we have got community members to speak about what is a patient-reported outcome measure, what is a patient-reported experience measure, what are patient-reported measures in general. So speaking about it in language and terms that is easily understood for their community. And so the talking posters, the community members come up, they wave their hands in front, and it narrates the voices for them as well. Again, making sure that it is culturally safe. So we have a lot of Aboriginal health shirts and lanyards as well. So the community members know that if our teams are wearing one of our Aboriginal health shirts, that we will operate and discuss things in a culturally safe manner as well. And making sure that we're really flexible in terms of the methods to capture patient-reported measures as well. And I heard Kimberly reflect on that as part of the Cancer Institute's program as well. So on to the next slide, Kim. For our enablers, we spend a lot of time engaging with the communities before the Auntie Jean's program. So we really get a good sense from the Aboriginal healthcare workers, but also the elders about what's important to them. Do they want us in the room? Do they want us just to join for lunch and yarning? Would they rather we not be in the room? And again, making sure that we're empowering the Aboriginal healthcare workers to really lead that as well. We make sure that we go to country with them, and again, making sure that we are meeting the participants to create that cultural safety as well. And then completing, as I said, we currently use the Promise 29, so it is a Western tool. It is not an Indigenously validated tool, but we are seeking to evaluate that, and we have got a whole raft of feedback from our community members about what the gaps are. So in identifying the gaps of current patient-reported outcome measures, we can then better identify what is a culturally safe and appropriate tool that will meet the needs of our Aboriginal health population across New South Wales, and in particular across our rural and remote areas as well. On the next slide, Kim, in terms of our challenges, the pandemic, not unique for New South Wales, but the pandemic was a real big challenge just in terms of getting the trust back again. We had a long pause, I think it was roughly 18 months with our Auntie Jean's programs where they weren't allowed to run, where we weren't allowed to go into community to do these programs. So that did have a pretty big challenge in terms of the pause in the middle. The Aboriginal healthcare workers do have a broad range of experience and also comfort level in terms of discussing what a patient-reported measure is. So again, really making sure that we're investing that time, effort and energy in yarning about what our patient-reported measures are, and also the time considerations as well. Measuring what matters to people is a small part of the Auntie Jean's program. They run lots of other social programs and interactivity as well. So again, making sure that we aren't burdening both the Auntie Jean's program, but also the community members who are going there for that social interaction and connection as well. I'll just move on to the evaluation on the next slide, Kim. So we do have a formally endorsed Aboriginal health monitoring and evaluation plan. And again, this was co-designed and governed with our Aboriginal health working group and co-created with our community groups as well. So we're really measuring what matters to our community and then evaluating both the implementation, and the implementation is really important for us in terms of what do we do and when and how do we do it? What is culturally safe practice? What is culturally appropriate practice? As well as identifying what the gaps are with current tools that are used across the health system. And then how do we identify an appropriate tool for our communities as well? We've largely leveraged off the Nabinya framework for our evaluation and really underpinning the key principles around landscape, resources, ways of working and learnings as well. Just on the next slide, Kim, for next steps, and then I will wrap up for questions. So at the moment, we are submitting our ethics application to SAHMRI, both for the evaluation, but also to make sure that the data sovereignty framework is fit for purpose as well. So that should hopefully go through in the next month or so. We're doing lots and lots of workshops with our communities, with our elders, with our Aboriginal healthcare workers as well, and community around Indigenous data sovereignty. So what are the principles? What do they look like? How do we operationalise these within the patient reported measures program? And what does that look like for our people as well? Once we have completed those round of workshops, we will then co-develop the Indigenous data sovereignty framework, and the ACI is partnering with an Indigenous led and owned evaluation company to really drive that Indigenous data sovereignty framework with us. We'll complete our formative evaluation, and hopefully we'll complete that by about February or March next year. And as I said, the formative evaluation is really looking at our ways of working, our ways of being, and our ways of doing, so around the implementation, but also looking at the self-reported information that we've now captured as part of the PRMs information as well. So what are the outcomes of our Indigenous communities? How do we use that to close the gap? And how do we make sure that we're capturing data with people and for people that's culturally appropriate? In the wrap up, and when we complete our formative evaluation, we will then incorporate whatever the findings are into our broader program areas, because we do want to scale this. And as I said earlier, it should be everyone's business, but how do we do so in a culturally appropriate and safe way as well? That is it for my presentation. My apologies for the connectivity issues, but happy to answer any questions if there are any, Kim.
Thank you so much, Mel. We really appreciate it. It's really, really interesting work. So thank you for taking the time when you're travelling to talk to us about this program of work. So I will open up for questions. So if anyone has got any questions, there is one that's online here that says, are the PRMs created in each language for various sites and areas? I presume that the person's asking in terms of language groups and diversity from an Aboriginal language perspective, and whether that's an issue that you guys need to consider in your jurisdiction.
Absolutely. So we haven't yet created PRMs in language for our Indigenous communities, and that will form part of our evaluation. We do know from speaking with our communities in the first instance that reading doesn't necessarily translate to speaking, and speaking doesn't necessarily translate to reading. So we do want to do that as part of our formal evaluation and make sure we get it right. We have done translations for culturally and linguistically diverse populations outside of our Indigenous populations, but again, that was done through and with community consultation and engagement. So if our evaluation does state that we need to do it, we will, but we don't just want to tick a box for the sake of ticking a box. We want to make sure that we do it appropriately.
Great. Excellent. Thanks, Mel. Is there any other questions? And Sarah from Health Translation SA, sorry, I've somehow lost the question box.
That's no, you've got them all. That was the last question that I've seen.
That was the last question. Was there any other
Kim.
questions from anybody at all? No, if there's not, I'd just like to thank Mel and Kim very much for your really interesting talks and for the great work that you're doing in your jurisdiction. I think there's some, absolutely some learnings for us here in South Australia. So we really appreciate you taking the time out of your busy calendars, and particularly with Mel travelling. We really appreciate, your expertise and your experience in this space. So thank you very much for joining us today. We'd like to also let people know that next week, the Patient Reported Measures in Action, next week's webinar is Wendy Saunders and Renee Taylor from the Adelaide PHN, and Tamara Crittenden from SAHLN, Southern Adelaide Local Health Network, and Flinders Medical Centre, and also Dr. Claudia Verdun from Queensland University of Technology. So if you're interested, please register for that. And just a thank you from Health Translation SA. to both Mel and Kim on your outstanding work. So thank you. So if you're interested in next week's webinar, please register, and thank you very much for joining us today. I think that's it. If you'd like to have any more information or get involved, here's Health Translation SA's contact details, and we thank you for your time in joining us today. So thanks very much.